I'm Jill Moss, and I'm the Director of Nursing and Midwifery for the North West Genomic Medicine Service Alliance. I suppose my role is to provide strategic professional leadership for nurses and midwives across the whole genomic pathway. I ensure that genomics is embedded safely, ethically, and effectively into everyday clinical practice. My aim, obviously, is to support nurses and midwives to build confidence and, more importantly, competence in genomic care. This covers various areas, so it includes shaping workforce development, strengthening clinical governance, contributing to service design, and representing the nursing midwifery voice, which is very important at regional and national level. Another area is a key focus of my role is to enable equitable access to genomic testing and ensuring that patients and their families receive high quality person-centred care as genomic medicine becomes increasingly integrated into mainstream services. And of course, this is what you're seeing currently with the 10-year plan.
My name's Barbara Coleman. I'm the Communications and PPIE, so Patient and Public Involvement and Engagement Lead for the NHS North West Genomic Medicine Service Alliance. And my role as that lead is to communicate and support the work of the Alliance, engaging with a wide range of audiences to highlight fundamentally what genomics is, and why everyone as individuals should be aware of genomics, as say what it is and how and where it's being embedded and mainstreamed within routine healthcare. That's for everybody across the Northwest and nationally across England. So that's communications across obviously all the traditional online and offline platforms.
I'm a genomics midwifery lead from the Northwest region. So it's a senior midwifery role, and it's about driving integration, genomics into maternity care across the region. And the main focus is really on strategic leadership. So it's guiding how genomic testing and how the pathways are to be embedded into maternity services. Also looking at workforce development, so it's upskilling midwives and supporting the education in genomics across maternity workforce, and also service improvement, so having like QI projects that improve outcomes for the communities and ensuring this equitable access to genomic testing, and also improving maternity genomic pathways. And we do quite a lot of stakeholder engagement, so we're linking maternity units, genetic teams, labs, NHS leadership, and also wider outreach work where we go around different communities and do genomics cafes, different parts of the Northwest region, which is really has a good impact, especially when you're looking at diverse communities and they've got language barriers, and it's actually making them understand what genomics is about. Also look at data evaluation. So data is really important, and we know our data is not that really brilliant. So we need to look at systems and improve that data and referral rates, and also supporting research access. And the main point is that as a lead midwife, we're acting a bridge between maternity services and the NHS Genomic Transformation Programme. And we want to ensure that all midwives are equipped and are prepared with genomics in order to improve outcomes from the communities we serve.
I was going to say, yeah, in answer to what genomics and why people should be aware of it, very much replicate what Jill said. You know, genomics is the study of our genes, that, you know, the complete set of DNA that makes each of us unique, you know, makes us, you know, who we are. And those genes act like almost like an instruction manual of how our bodies grow, develop and function, you know, and genomics differs to genetics in the fact that genomics doesn't just look at a single gene, but they look at them all and how they all work together, and as Jill said, how they interact then with our environment, and really, as Jill very rightly said, understanding genomics enables, really, it's a key enabler and empowers everyone to make those informed decisions about their health, and also to feel more confident about how their genomic and genetic data is used safely and responsibly within the NHS. And again, a lot of the work that I've been undertaking with the community cafes has been very much just reiterating sort of just key phrases that people may hear if a family member or themselves go down what we say like a genomic journey, if something's identified as having that link. So that's really what sort of, not to wanting to duplicate what Jill's already said, but yeah, that's sort of what I think genomics is, and how and why it's so important people are aware of it.
Okay, so one of the most exciting genomic research projects currently taking place in the Northwest is something called the Generation Study. It's a pioneering national research programme delivered in partnership with the Genomics Unit, Genomics England, and then the NHS, and so that's where we come in. From the Genomic Medicine Service Alliance. The study is sequencing the genomes of up to 100,000 newborn babies to explore whether whole genome sequencing can be used alongside traditional newborn screening to identify over 200 rare but treatable genetic conditions in very early life. So this is in the neonatal period, basically within the first month of life. It aims to evaluate the feasibility and utility of genomic screening at birth, improve our understanding as to how genomic data can enhance diagnosis and treatment, and explore the ethical and practical implications of storing genomic information over a lifetime. And of course, Barbara referred to that earlier. Early detection through the research has the potential to transform outcomes and quality of life for children and families by enabling earlier clinical intervention and generating valuable data for future genomics research.
Jill's quite rightly said, I think that the Generation Study is a key research project that again is available across the Northwest. It's an increasing number of hospital trusts, isn't it, Jill? But an aside to the Generation Study, there is a huge amount of innovation happening elsewhere across our region, within rare and inherited disease, where genomic testing is helping families who may have spent years searching for a diagnosis to finally receive some answers. We're also seeing exciting developments within cancer care and cancer genomics. And again, you may have seen in the media recently that there's a process called liquid biopsies, which is basically being used within cancer care to identify if that cancer DNA is circulating in the bloodstream, which again can have implications on the care for that patient. So it's enabling cancer care to become increasingly more personalised to the patient. And as I say, we have the Northwest, particularly in the Northwest Alliance, has really strong partnerships and relationships, obviously within the NHS, but also within universities, academia and research organisations. So it's meaning that patients within our region are able to take part in cutting edge studies that can then help shape the nation's healthcare moving forward.
So genomics plays an increasingly important role in maternity care by enabling earlier, more accurate identification of genetic conditions that may affect a pregnancy or baby. Through screening, diagnostic testing and family history assessment, genomic medicine supports informed decision-making and personalised care planning for pregnant women and their families. It can also identify or clarify the cause of ultrasound findings, and of course this takes place throughout the maternity pathway. It can identify inherited conditions and guide appropriate referral to specialist services. Genomics also supports reproductive choice by providing access to carrier screening and, where appropriate, prenatal and pre-implantation genetic testing. By embedding genomics within routine maternity pathways across the NHS, we can ensure pregnant families receive timely information, coordinated support and compassionate evidence-based care tailored to their individual circumstances.
Again, you know, there's not not much that I can add to what Jill said, but I think fundamentally, I think genomics will become an even more integrated part of maternity services, you know, helping ensure that babies and families receive the right care at the right time. I say, because genomics can help make those informed decisions, which again is a phrase that, you know, we've obviously said a little bit earlier, but also prepare families for any specialist care that's maybe needed, and in some cases access earlier treatment. So it really does support that maternity care and pregnant families.
Members of the public can get involved in genomic research in a number of meaningful ways. Many NHS organisations offer opportunities to participate in research studies, including large national programmes such as the Genomics England initiatives and projects delivered through the regional alliances such as the North West GMSA. People can volunteer to take part in research studies, contribute samples or health data where appropriate, or join patient and public involvement panels. And of course, we have one within the GMSA, and this can help to shape how research is designed and delivered. These roles are vital for ensuring studies are ethical, inclusive and reflective of the communities they serve. Information about current opportunities are available through the NHS research websites, local trusts and national platforms, and an example of that would be called Be Part of Research. It enables individuals to contribute to advances that may benefit for future generations.
Yeah, so, you know, some members of the public may be invited to take part in research through their NHS care or their NHS care pathway, and particularly if they're undergoing genomic testing or they've already undertaken genomic testing too. And as Jill quite rightly said, you know, public involvement doesn't always mean having to give a sample. You know, people can join our patient and public voice panel, and we are actively always recruiting to that. But there are also other regional and national advisory panels, which again all serve to help shape that research design, and where people can share their lived experience, which is so valuable in improving how services are delivered. So, and again, as Jill quite rightly said, getting involved helps to ensure that the research reflects the communities within which it's embedded. So it's the diversity of our communities, and the more representative genomic research can be, then it ultimately supports more equitable and effective healthcare for everybody in the future.
It's completely understandable to feel unsure or nervous about taking part in research, whether it's genomic research or any kind of research. These decisions are personal and no one should ever feel pressured into participation. I would reassure them that the participation is entirely voluntary, and they will be given clear, accessible information to help them make an informed choice. They will have opportunity to ask questions, discuss any concerns, and also, more importantly, they can take time to decide. They're not rushed into it, they're not time limited. Confidentiality and data security are taken very seriously, and there are also robust safeguards in place across the NHS and research partners to protect participants' information. Most importantly, choosing not to take part will not affect the care or any care they or their family will receive. The decision has to feel right for them. And another thing that must be said is that even if they decide to take part in research, they are also able to withdraw. Just because they sign up, it doesn't mean to say they are locked into it. They also have the ability to withdraw should they decide to change their mind. And again, it's not time limited. They can withdraw at any point and their data will be scrubbed from the system. What excites me the most is its potential. And its potential to move healthcare from reactive to proactive. And this, of course, is mentioned in the 10-year plan that came out in July last year. It identifies risks earlier, diagnoses conditions quickly, and tailored treatment to an individual rather than a one-size-fits-all approach. As genomics becomes embedded across the NHS, we have an opportunity to reduce health inequalities, improve outcomes for people with rare and inherited conditions, and importantly, it supports more precision prevention strategies. I'm particularly inspired by the growing confidence of nurses and midwives in leading this transformation, ensuring genomic medicine is delivered with compassion, equity, and a strong focus on person-centred care.
I say what excites me most about the future of genomics in healthcare is that it's not just about science. I think genomics can sound complex, but it's really about giving people and individuals some clarity. It can obviously support these earlier interventions and enhance outcomes of care. And really being part of that transformation within healthcare is incredibly inspiring. And what excites me most personally is the shift towards, as Jill mentioned, the personalised precision healthcare. Genomics really does enable and support that tailoring of prevention, diagnosis, but also that treatment, again, taking it back to the individual. So, and equally important is the opportunity to reduce those health inequalities by ensuring that the genomic medicine benefits are available to everybody in our communities, particularly across the Northwest, which has a particular diverse population group. So yeah, that's really what inspires me and excites me about the future for genomics.
Return to genomic transformation work. So we're looking at improving genomics, testing pathways in pregnancy, strengthening referral routes to clinical genetics, supporting midwives to use genomics confidently, because obviously if they're not equipped, they won't have that confidence. So it's about gaining that confidence. And also look at it's improving the variation in access across the maternity units in the Northwest. We also how long have I got? There's so much work. So the Northwest region is a major contributor to the National Rapid Whole Genome Sequencing. That's for critically ill babies. And the work includes the pathways in neonatal and paediatric intensive care, also training clinicians and midwives on when to escalate referrals, and also ensuring access across all the Northwest Hospital. And the most newest thing we're doing, I don't know if you know about it, it's a generation study. So the generation study is it's an NHS genomic signal and research programme. And what that involves is sequencing whole genomes of 100,000 newborn babies. And that will detect over 200 rare conditions. And the idea is once that condition is detected, you can start treatment rather than waiting for the symptoms. And this will find conditions that much earlier, rather than waiting 2 to 3 months. So babies can actually, like I said, receive treatment before symptoms appear. So parents, they're normally recruited during pregnancy. And then when the baby's born, they take a sample from the cord blood after birth. And the results, we've got quite a quick turnaround time. And once we've got the result, the positive, we can act on it straight away and there's no delay. Another one is a payload study, and that's that's a rapid genetic point of care testing. So basically, if a baby is admitted to intensive care unit, some babies are at risk of gentamicin-induced hearing loss, which is an antibiotic. So what they do, they'll do a test to ensure that the baby can receive these antibiotics. So if they can't receive the antibiotics, they'll give them an alternative. So that means you're preventing hearing loss in these babies. We're also involved in workforce upskilling education, which I've mentioned before, and that's going around training, providing genomics training, having workshops, case-based learning, and also looking at development of genomics champions in the maternity units. Also work closely with GEP, which is Genomics Education Programme. So that is looking at training and looking at things like midwifery and nursing, genomic passports, which is about their learning. And one of the important things is looking at equity inclusion projects. So as you know, North West region has a diverse population, so the GMSA is prioritising and looking at reducing disparities in access to genomic testing, and that's where the data is really important. Looking at cultural sensitive engagement, and that's when we're doing all these genomics cafes, going around speaking to different communities, and also improving awareness of carrier screening in high-risk communities. So this work is over like all the region, including Liverpool. And another important thing is they've already mentioned digital and data pathway improvement, and looking at improving digital systems and how we refer, standardising genomic test ordering, and ensuring that the maternity EPR systems are supportive of genomic pathways. Yeah, in a nutshell. So yeah, so some of them are things like which are newborn screening. So you will have some of them are very rare disorders, which obviously we don't know about, but some of them are like cystic fibrosis, and then you will have which is a quite common one, which is also in the newborn screening. You've got your sickle cell thalassemia. You will have multi-chain disorders. So there's quite a few that will come under hypothyroidism. And there's many others, you know, that there's quite a lot. I didn't prepare for that. I'll try and look for something really simple, because some of them quite difficult to pronounce. There's a lot of congenital adrenal hyperplasia, and that is like a deficiency. Also, congenital bile acid synthesis defect. The congenital diarrhea, congenital generalized lipodystrophy, which is type 1, and then there's also type 2, and then there's type 3, and so forth. And you've got also, I've mentioned before, congenital hypothyroidism, and there's different types, not just one type, there's many types. Also, I've mentioned cystic fibrosis. And then there's cystinosis, nephrotic, and that's some of the conditions that we screen for, and also congenital hyperinsulinism, which is like a familial condition, polycystic ovaries as well. How it's tested is they will take a cord blood, so when the baby's born, from the placenta there's a cord, and they'll take the blood and they'll get sent off for the labs. Now, sometimes if they miss that or they can't get hold of the cord blood, they can do a heel prick test on the baby and take the sample that way as well. I think there's quite a lot of myths, and sometimes people think, particularly among some communities, they don't think that from a sputum you can gather all this DNA sample, and then it's like very simplifying it to say, actually, this is how it works, and look at the family history and just saying, well, look, this person looks like you or looks like the dad, so therefore that is kind of genomics. Sometimes people often assume that genetic testing gives definite answers, but many results it might just be a chance of a condition, but not, you know, so you've got to just be really, really clear that it doesn't mean that you will have a condition. So for example, I'll give you an example. If someone's got, say, sickle cell thalassemia trait, so if you have a partner who's not a carrier, so that means that your child will inherit 25% chance of having that carrier status, or 1 in 4. And I think some people think if they've got their carrier, or the baby's going to inherit the condition, but it's not like that. It's more simpler. It's like if you marry with somebody with the same condition, then you've got a higher chance. Some people believe that genomics can predict everything about future health, which isn't the case, because most conditions involve a mix of genes, lifestyle, and also environment, which is known as epigenetics. And the other genetic finding, I mean, some people think that if someone's definitely got a carry, like I've said, or got a genetic condition, they're definitely going to pass it on, but not necessarily, because it doesn't work that way. And that's why it's important that if there is a condition in the family, that they seek medical advice, get referrals for counselling and find out more about the conditions. And sometimes people think that if the result says a variant of uncertain significance, it means that there's something wrong, but it just means that we don't know anything yet, and there's further investigation to carry out. And I think the main concerns is about data security. Even though the data is stored in highly controlled environments, people still think that there's going to be a data leak, or their data is going to be used in research. And I think, and that's why people don't come forward to research, because of the data element. So with the genomics tools, you've got like non-invasive prenatal testing. So which you're looking at fetal exome sequencing, and that helps to identify conditions earlier. And it means that if you're going through that process, it gives you clear explanations for further tests. And if it is a positive test, there's faster access to specialist care. And it gives you that clarity and reduces uncertainty at a time when most families are really, really vulnerable. It also supports reproductive choices, so such as like carrier screening. So you give families that information before pregnancy or early in pregnancy, and that's about understanding the chance of passing on a condition, and so they can plan future pregnancies as well. And access, so if they get pregnant and there is a risk factor involved, or they've got a high chance of a baby inheriting some condition, if they contact, as soon as they know they're pregnant, if they contact the GP or the midwife, you can instantly send that referral and get them seen and get any testing done what's required. It's also better care for babies after birth. So with all these screening, generation study, rapid whole genome sequencing, this can actually avoid life-threatening crises and also can guide treatment. And for many family, it kind of ends the diagnostic odyssey journey before it even begins. Because if you can imagine, whereas before you've had the baby and then you notice that there's something not right about the baby, and then you start all the intervention with all these testing, you're avoiding that odyssey because you've already resolved it and you've started treatment. So therefore that baby won't have that symptoms, and the baby won't suffer, and obviously it'll support the family. Also, more equitable access to specialist support. So if we train more midwives, health visitors, nurses, and especially with the communities, the midwives or the health practitioner feel confident in sending a referral to clinical genetics, and they can ensure that they receive expert counselling, clear explanation and coordinated care, and also personalised cares. It also strengthens midwifery practice, so it enables, so when the patient comes in for the first booking pregnancy and there are some red flags, if the midwife's equipped with that knowledge, it kind of enhances the ability to provide holistic care, and they can explain the test confidently. They can guide the families through choices and recognise when to refer, and also they can be an advocate for equitable referral. And that's why it's important that it's a core part of midwifery education and transformation programme. Conception care is really important, because if you're a new couple and you want to try for a baby, but then you understand that either one partner's got a condition, so if they seek that advice early on before getting pregnant, they've got the right treatment, and you can prevent these occurrences and have a safe pregnancy. That makes sense. That's a thing that we really need to focus on as well. I mean, going further, I mean, looking at, how can we support midwives? Because a lot of midwives, they don't really get involved in preconception care. They'll only might get involved if they've had a baby that's affected. So the future planning, But ideally, we need to get away from that and just say, well, actually, you know, we need to be talking about preconception care, why it's important, and what the positive outcomes are for preconception care, especially if you know a family that has a condition. And that's more like in primary care as well, focus around that, you know, education, the primary care workforce. We have a really good genomics education team that do quite a lot of work with GPs as well. So we kind of collaborate together, looking at e-learning around improving the knowledge around all primary care practitioners, as well as midwifery and the 0 to 19 teams, which includes health visitors, school nurses, etc. I can talk a lot. Yeah, so basically the generation study, if you're pregnant across the Northwest, there's a number of units at MFT, 3 Trust, at Bolton, and also at Macclesfield, Mid Cheshire, and yeah, so all these trusts, and East Lancashire, not to forget to mention East Lancashire, they're offering generation studies. So if you're pregnant, they will approach you and just say, oh, we've got this generation study, are you interested? And give them that guidance and go through the consent process. Also, you can access the GMSAs. They have a lot of PPI groups, patient involvement and lived experience group, and that's quite a good way of getting involved and guiding. You can guide that practice, especially if you've got lived experience. And that's really important because, you know, we need these participants to come forward and talk about their experiences, because we don't know everything and all communities are different. So I think there's a lot involved in that. And then sometimes when we have these genomic cafes, we always ask if, you know, we always kind of, request isn't the word, but inform them that there are opportunities available to come forward as a volunteer and find out more about genomics. And I think going forward, we'll be looking at the genomic champions within the communities, and also probably within the public sector, so everybody knows about what genomics is. As going back a couple of years ago, nobody knew what the word genomic means. But if you said genetics, they might have some idea, but still unsure. And I think, excuse me, at that time, a lot of health professionals didn't think it was part of their role. And I think it's really important that they know it's everyone's role, as is EDI. You know, we're all part of it, and it's really important we address these concerns and support these communities and to come forward and talk about research. And there's also lots of research studies for gene and health for different communities, and it's just about researching and finding out and looking at what opportunities are. So maybe if you don't access maternity care, you can ask your GP what research is there. They always have some studies being undertaken. GP, and even so sometimes if you go to like your health visitors, they'll know about certain studies that have been undertaken, and the families can think, well, actually, I want to be part of that study. And I think for the Black and South Asian community, I think it's really important, because these communities, they don't get involved in research because previous myths or the mistrust with NHS. And I think the key is taking away that myth and providing that trust that this is how it's going, and being informed, giving that information so they've got confidence in the service and in the research. Because if you're not clear, if you don't give clarity about the research, what it's about, they might think, well, if they're giving me a product, is it halal or is it kosher or something like that? So there's a lot of things that we need to be thinking about and be mindful, because everybody is different, and